incorporate all you guys into it. Somebody read off what's the first skill.
Verified the physician's order for blood products.
You're on verbatim. You're on the blood products, by the way.
Verify and verbalize physician's order.
All right. So we've got our physician's orders over here. So, all right. So we've got Solumedrol, 80 milligrams, IV push, now, from Dr. Bud Love. Date today, time now. All right, this is for Mr. Robert Davis, and he's got a medical record number as well right here. This is the part I just want to show you before I forget. Allergies and sensitivities, where it says no known allergies. That's the checkbox I'm talking about, because he really does have an allergy to penicillin. So unless that box is checked, this is not applicable. Make sense? Okay. So, which we kind of just did verified and verbalized patient's medication allergies. Okay. What's next?
Verified
Allergies.
compatibility of medication.
Got allergies.
All right. So we've got our pump. Let's say we've got calcium gluconate running. Okay. So we don't have anything up at the moment. So remember that. I'm bringing you all into this later. So calcium gluconate is running. Let's see. Verbalize 5 rights of the medication administration. So before we move on, is calcium gluconate compatible with Solumedrol?
Nursing Central.
Nursing Central, yep. Work it out.
4 years.
Solumedrol, calcium gluconate, are they compatible?
So in this
They also have
SPD,
that
we're allowed to
website.
bring Nurse Central with us?
They have the
Before, we weren't allowed to bring our phones with us to the SPD.
You need to know what.
Oh.
We had the list of
Yeah,
medications.
Yeah, you'll have a
Yeah,
list.
Yeah.
okay,
Well, they had a list online of the medications.
Yeah.
we
So you'll need to
know.
memorize for that.
okay.
Okay.
Also, we need to okay.
There's not that many.
It is compatible.
It is compatible?
Well, calcium gluconate is almost like a mechanism.
Are you sure?
Listed.
So it's not.
I don't think it would be, because calcium is a pretty,
It's not compatible.
So it's not compatible. All right. So keep that in mind. So then we're verbalizing the 5 rights of medication administration, okay? So we've got our patient. Patient's Mr. Robert Davis. We've got our medication, Solumedrol. Dose is 80 milligrams. We've got our time is now. And the route is IV. So you need to verbalize all of those to us, okay? So we will go find our Solumedrol. And I've got Solumedrol 125, and I've got Solumedrol 40. So which one am I going to use, y'all?
40.
What's the order?
The dose is
Blake's getting 80. Yeah.
Dose is 80.
So wouldn't that be easy to use? 8 milligrams?
What's on hand?
I've got a 40. This is all I have, though. I have a 40, and I have a 125.
Oh, okay, 125.
125.
So 125 is right up.
You would think that you could pop out 2 40s. They're not going to do that for you. They're going to give you a 125. So you also got to look at it and look at the expiration date, which is 12 of 2020. So we are good with that. So next, prepared medication correctly, including dosing calculation and label medication syringe. So we're giving 40 milligrams. This is where you guys come in.
Okay. Check it over.
Do math in your head, Harrison.
Yep.
How many milligrams?
So
how many?
This is 125 milligrams in 2 milliliters.
And 2 milliliters.
And
The dose is 40.
80.
Dose is 80.
62.5.
That's fine.
Will there be
Oh,
calculated?
there's some up there.
They would have.
If it's above 1, you round to the nearest.
Depending on your syringe. But I'll give that, yes. That's where I was gonna go with it.
Is that a good word for you?
No, I need the full, to be able to draw it up.
So you need a
So,
syringe and-
how do you need to administer it? Over what amount of time? Solumetric.
I will tell you in just a second from Mercy Central.
Perfect.
I got it phone down to.
Is that gonna work for you?
I need a female syringe if they've got it.
Okay.
Or 5 mils.
If you get a new phone, you have to call them.
Maybe administered, I'll be pushed 3 to 15 minutes.
3 to 15 minutes. Okay.
Giving you very much time.
Just 1 second. We're just finding some needles. While she's getting that, I'm preparing my label for my syringe, okay?
It's over
I'm waiting on
3 to
my
15 minutes.
syringe.
Oh, okay.
It's over 3 to 15
30
minutes.
seconds per
It's a being a thing.
Thank you. All right. Thank you very much. All right, so we've decided it's 1.3 mils of the medication that we need to draw up. So how are you going to give that over 3 minutes? Or 3 to 5 minutes, you should say.
0.4 mil per minute.
What's going to be easier?
Let's see, half a mil a minute.
Half a mil a minute? Needs to be exact. You can add stuff to this. Does it need to be diluted or not?
Yes.
So,
So we have one
You can
point,
give-
should we just put a point,
You can do it over 6 minutes and
point
do,
77?
and do 0.6 milliliters a minute.
there's something easier.
Can we put 0.7 milliliters of saline in it, diluted with 0.7?
What would that put it up to? You've got 1.3.
It'd be 2 milliliters.
1.7 and do 1 mil a minute.
There you go. That would be the easiest way to do it.
Okay, say that all again.
So.
I'm gonna do it one more time, shorter
one-
version.
Yep. So, we need to take 1.3 mils.
Okay.
Okay? So, the fastest you can give it is 3 milliliters over 3 minutes. Or 3 minutes. So, get it to 1 mil a minute. Get to 3 milliliters. Okay? So then you're doing a simple 1 milliliter, wait, 1 milliliter, wait, 1 milliliter, wait. So you've got 1.3 already in there. So just add your 1.7 to get up to your 3.
Okay.
Does that make sense?
Yes.
So then, drop your medication.
Is everything compatible with sodium chloride?
No.
Okay.
Most, yes. You put Valium in it, and it's going to turn cloudy in a second.
1.8 milligrams.
So what would you have to do if you wanted to do that?
It may not need to be diluted. Valium doesn't need to. I learned that the hard way, by the way. So I put 1.3 mils of air in, and I'm pulling out 1.3 mils. Okay? flushes.
Oh. I have.
That'll work.
this. Are you okay with that?
Yeah. Yeah, we'll do this. Because
Okay.
we got sodium chloride here,
Okay.
so we can do it that way. I would usually pull it from a flush. So, open up a new one. Every top 30 seconds. Seconds. And I'm gonna pull 1.7 out and get to my 3. Careful not to push in or you're pushing medications up into your vial. Okay, then you've got your 3 mils of medication. So you've got 80 milligrams in 3 mils. And that's how you should write it on your label. Thank you. All right.
We're not supposed to have gloves on yet, right?
What is the difference?
Not yet.
Not yet, okay.
That's when you're going to, this is preparing the medication. This is just the preparing. All right, so. Now you've prepared it, you've done your dosage calculation and labeled the medication syringe. You're gonna move on and obtain your 2 10 mil normal saline syringes.
Now you need the 10 minutes.
Yeah. Which even if you just have empty ones, it'd be fine.
Empty.
Yeah, because I can't use,
Okay.
I can't flush with here anyway.
Right. It's a cap for that
Thank you.
one. Uh-huh.
Okay? So you're walking in with, don't throw out your vial, by the way, because you have to scan it. So you have that, you have that, you've got your medication. So now you're ready to go in your room, okay? You go in, obviously wash your hands. Verified and verbalized client's identification using at least 2 identifiers at the bedside with the physician order. So looking at this, which would be your 2 identifiers?
Name and address.
Name of birth?
There's no date of birth on this.
Just ID and name.
Yep, medical record will work. Okay. So you've verified. Now you're gonna apply your clean gloves. Try to. Yeah, these are supposed to be large. All right. So now you come over. Let's just say this isn't even here. This is attached to your pump. That's the only access you've got. So it's connected to your calcium gluconate, which we've already decided is incompatible. Okay. So clean the injection port appropriately with antiseptic, which I'm gonna add this to it so that you can see it better. So this is the port you're going to be going after. It's closest to the patient, okay? So, get a fresh alcohol swab. You should use fresh ones for each time you do something. Cleaning it. How long do you clean it for?
30 seconds.
Good. Okay. So. That's the occluding right there. Okay. And put your pump on pause. Okay, so you're gonna pull back, look to see if you've got blood flow, assess the patency of your IV. Then how much are you gonna flush?
10.
10 mil.
Good, because this is incompatible. Correct, so flush it slowly, make sure that it is flowing nicely. There's no pain with the patient. It's actually working, so I'm gonna keep going. Yeah, okay. All right. So, now that you've flushed with 10, you can start to give your, okay? So, clean it again. 30 seconds. Attach your syringe. And I'm gonna push a milliliter in. Then I'm gonna wait how long?
1 minute.
1 minute, good. Then I'm gonna push again, another milliliter. I'm gonna wait a minute. Push a milliliter, wait a minute.
So do you push over the 1 minute period, or you can just push and then just wait the rest of the remainder time?
That's a question everybody asks. If you try to time it like that, it's gonna be difficult on yourself. So you can just go the whole full 1 mil and wait. So that way you can have time to interact with your patient and you can actually talk with them, give them a little eye contact time, and
Watch for signs of
Mhm.
allergy or anaphylaxis.
Yep.
Yeah.
Is this with every medication?
I'm sorry?
You can do that with any
Yeah.
kind of push?
Mhm.
Okay.
as long as you've broken it down.
Right.
Yep. Okay. So. Now we're still in the middle of flushing the IV with 10 before and after, so now we're done. So we're going to flush it again. This is a clean one. 30 seconds. Now, when flushing your medication is still in this line. So, how fast am I going to flush this?
Same rate.
Good. For how many mils?
10.
You do not have to flush for the next 10 minutes doing that, but 2 to 3 mils at a minute apiece to get it out. And then you can finish off your flush. Okay? Once done, don't drop the needle in the bed. Restart your IV fluids. Then we will come down to the bottom. The following must be done at the end of any type of IV bolus delivery, existing line or saline lock. Verbalize the assessment of the patient's tolerance. Patient tolerated it well. There's no signs of swelling or infiltration. And verbalize reassessment of IV site, and verbalize I'm documenting it in the medical administration record. Okay, so if it were compatible IV fluid, I would have done the same except 2 to 3 mils prior and after. And then if it was not connected, that's when, as you're pushing, right at the end of your flush, while you're still flushing, clamp your line. That's the positive pressure I'm talking about. Okay, that way that doesn't backflush. Everything make sense?
So the day of, we can walk in on three of those, or one of those three situations, it can be like that, okay.
On the day of, you're going to walk in and either you will pick one or we will give you
Okay.
an order.
And then also with the arms, I know you can't put the fluid in there, so will you switch out an air needle for the medication, so you can?
Just put it up to it and then
And
you
then
can
just say-
verbalize what you're doing.
Mhm.
And then we'll speed you along like I did with, 30 seconds, okay. As long as you tell me that.